Hi, everyone. Welcome. Again, this is the Agricultural Worker Identification, Registration, and Reporting in the UDS webinar. My name is Katie Kahneman, and I work here at NCFH as the lead public health project coordinator. And today we're going to be covering three main learning objectives. So by the end of this session, you'll be able to differentiate between registration and classification versus eligibility. You'll be able to identify industries and tasks that meet the definition of agriculture and should be considered when classifying an agricultural worker for your UDS reporting. And you'll be able to distinguish the different classification types of agricultural workers and utilize this knowledge to correctly classify and report ag worker patients. So for those of you who may not be familiar with NCFH, we are a private nonprofit organization located outside of Austin in Buda, Texas. And our mission is to improve the health of farm worker families. And we do that by providing programs, trainings, technical assistance, research, and resources. And we're very proud to be serving over 175 community and migrant health centers in our network who provide primary care services to agricultural worker families. One of the ways we address our mission is through the Ag Worker Access Campaign. This initiative was launched in 2015 as a joint effort between NCFH and the National Association of Community Health Centers, or NAC. We, along with health center staff and other ag worker advocates, knew that more could be done to increase access to quality healthcare for America's agricultural workers and their families, and thus the Ag Worker Access Campaign was created. The goal of the campaign is to reach 2 million agricultural workers and their families in the health center setting to receive care. And we've seen steady increases, as you can see in this graphic, over time. We surpassed our halfway milestone in 2021 of reaching more than 1 million ag workers. Unfortunately, in 2022, we saw a decline, likely due to the impacts of COVID-19, but we're really excited to share that this past August, the UDS data was released, and it showed once again we've passed that 1 million milestone. So thank you all for all the hard work you do to serve agricultural worker families in your communities. And to keep this momentum going, we invite you to join the Ag Worker Access Campaign. We will share a link in the chat and information at the end of the session as well to join this initiative and show your support. So we're going to go ahead and get started with talking about some important reasons why it is important to identify a patient as a member of a special population, kind of setting the foundation for our ag worker identification process. So the federal government has identified groups of community members that have limited access to healthcare services and have unique challenges in accessing services. Therefore, the government provides funding to support the provision of health services that specifically target these special populations. And on the slide here, you can see a list of patients considered belonging to a special population. So our homeless or unhoused, migratory and seasonal agricultural workers, veterans, patients served by school-based health centers, and patients served at a health center located in or immediately accessible to a public housing site. So it's important to identify all members of special populations, whether or not you receive direct funding to serve that special population. So what is UDS and why do we report in our UDS report? So UDS stands for Uniform Data System. It is a government required electronic reporting mechanism for health centers funded under the Public Health Service Act, Section 330. That includes community health centers, programs for migrant health or migrant health centers, healthcare for the homeless, and residents of public housing. So here on the slide, you can see a list of some of the information that's reported in the UDS report. For example, number of patients served, patient population demographic information, such as race, ethnicity, age, income, insurance sources, things like that. And why is it important to accurately report UDS information? Well, first, it's important to be in compliance with the requirements of our funding. And it's important to show accountability and good return on investment so that we can be good stewards of our funds and have continuation of funding. So this slide shows the relationship between status verification as a member of a special population and how it relates to your funding. So when health centers apply for funding, they'll mention in their grant applications the number of migratory and seasonal agricultural workers that they're planning to serve. And if they receive the grant funding, they acquire several obligations. Among those obligations are to be in compliance with the program requirements, to provide services to the target populations, and to submit UDS reports. So if the health center is able to be in compliance with the program requirements, establish an identification and verification process, show that the funds were used to provide services to the people it was intended for, and submit reports on time, the likelihood that a health center will continue to receive funding is pretty good. And so we go over this relationship between your UDS reports, identifying your special populations, and how it relates to your funding, just to set the stage for how important it is that we are identifying our agricultural workers so that your health center can continue to receive funding to serve this very important population. So who reports what and where? To answer this question, it is important to refer to the 2024 UDS manual, and the link to that is coming through the chat, and we'll share and follow up. This manual shares that health centers that receive Section 330G funding must provide separate totals for migratory and seasonal agricultural workers on lines 14 and 15 of their UDS report, and on line 16 will be the total. For other health centers that do not receive 330G funding, they report their total migratory and seasonal agricultural worker patients on line 16. So all health centers report these populations regardless of whether or not they directly receive special population funding. So before we get into some really important definitions and how we determine whether a patient is a member of the migratory and seasonal agricultural worker population, we want to talk a little bit about the difference between verification and eligibility as it relates to agricultural worker special population designation. It's important to remember that we are verifying a special population status when we identify a patient or family member as an agricultural worker in order to properly report and document in your UDS report. So this doesn't have anything to do with the patient's eligibility to receive healthcare services. As we know, all community members can receive services at health centers. However, the patient may be eligible for sliding fee discounts or other programs based on income, depending on your health center's specific program offerings. So the classification of a patient as a member of a special population does not impact their eligibility for receiving services. Okay, so to verify migratory and seasonal agricultural worker status, you need to know three things. First, the definition of agriculture, the types of industries and tasks in agriculture that are included and excluded under HRSA's rules, and the classifications of agricultural workers. So we're going to break these three items down in the coming slides. So this slide includes the exact language for the definition of agriculture as defined in legislation. Basically, it involves everything from prepping the soil, seeding, planting, growing, picking, packing, to transporting. Agriculture means farming in all of its branches, including crop production, animal production, aquaculture, and the support activities involved in those industries. One thing to note is that this definition of agriculture is specific to HRSA, and definitions can vary among other entities and other government programs, such as migrant education or other ag worker serving programs. So it's important to note that the definitions that we're reviewing today are specific to HRSA. And then the classification of agricultural workers. So in addition to the definition of agriculture, HRSA has defined the three classification types for agricultural workers for UDS reporting. migratory workers, seasonal workers, and our age and disabled former migratory agricultural workers. So on the slide here, you can see a table outlining the key components of the definition of each of these classifications. So for migratory, a migratory agricultural worker's principal employment is in agriculture. They've been employed in agriculture within the last 24 months or 2 years, and they establish a temporary home for the purposes of working in agriculture. And our seasonal agricultural workers, their principal employment is in agriculture on a seasonal basis. They've been employed within the last 24 months or 2 years. And they're not a migratory worker because they do not have to establish a temporary home in order to work in agriculture. And then our third classification are our former migratory agricultural workers who are unable to work in agriculture due to age or disability. And then the note at the bottom there says workers and their family members receive the same classification. So family members and dependents of migratory, seasonal, or an age and disabled former migratory agricultural workers will all receive the same status as their agricultural worker family member. And we'll break these definitions down even further and practice some scenarios towards the end of our time today. So now we have the definition of agriculture, the definition of the classifications of agricultural workers. So now we're going to look at the tasks and industries that are included and excluded in HRSA's definition of agriculture. To set the stage here, how these tasks and industries and what's included and excluded in HRSA's definition of agriculture, the NAICS codes were used to determine these definitions. So the NAICS codes stands for North American Industry Classification System. And the codes that are included in the definition of agriculture are 2 codes and 2 subcodes. So the 2 codes are 111 crop production and 112 animal production and aquaculture. And our 2 subcodes are 1151 support activities for crop production and 1152 support activities for animal production. And in the chat, you'll find the link to the NAICS code search. The NAICS code website has a search engine where you could type in a task or industry and see if it comes up with any of these codes or subcodes at the front of the task or industry. And that will let you know whether that type of work falls within the definition of agriculture. So we're going to break down these codes on the coming slides and go through some examples of tasks and industries included and excluded in HRSA's definition. So 111 crop production. This includes a lot of the common crop production tasks and industries that you can think of, like grains and nuts, fruits and vegetables, nurseries, other commodities like tobacco, cotton, hops, and Christmas trees. And then support activities for crop production. This includes harvesting by machine, post-harvest tasks like, excuse me, sorting, packing, and processing on the farm. And one thing that is important to note with post-harvest, such as sorting, packing, and processing, the key words on this type of support activity is on-farm versus off-farm. So, for example, transportation. If a farm owns their own transportation vehicles and hires their own drivers to do transportation of their crops, then those transportation workers, the people who are driving the trucks, packing the trucks, driving them to the crop to the next destination, would be considered agricultural workers. But if a farm hires a company, a different company, transportation company, and that driver comes and picks up the crop and drives it to the next location, that becomes a different industry. So that person driving that truck is in a trucking and transportation industry, which does not fall within agriculture. And another tricky one, similar to this with the on-farm, off-farm kind of caveat of the definition is for post-harvest packing. So some farms will have packing houses on site, and then some farms will send their crops to a packing facility. So if the packing house or facility is on the farm's property, it is owned by the farm, all of those workers are considered agricultural workers. Once the crop leaves the farm and goes to a packing house or facility of some kind that is not owned by the farm and is off the farm's property, it becomes a different industry, and those workers are not considered agricultural workers. So there are some tricky caveats to consider, but we'll go through some of those today, and feel free to put your questions in the chat and Q&A box as we're going. And we have one question in the Q&A box already that relates to the classifications of agricultural workers. And the question is, where would you classify an aged and disabled seasonal worker? So our aged and disabled seasonal workers are not considered, they don't have their own classification. So in the 1996 Consolidation Act, the government added the classification type of aged and disabled former migratory workers. So all your former migratory workers who stopped working due to age or disability will get classified as migratory workers in your UDS report. There is not a classification type for aged and disabled seasonal workers. But one thing that may be important to ask an aged and disabled seasonal worker is if they ever migrated in their lifetime. And sometimes they can qualify for that aged and disabled former migratory worker if they formerly were a migratory worker and maybe they stopped migrating because of age or something like that. So that could be a way that you could still find a classification for them. Okay, so let's go on to our next NAICS code 112, animal production and aquaculture. This includes dairy farms, animal farms, poultry farms and hatcheries, and fisheries. One important note about fisheries is that deep sea fishing is not an industry included in the definition of agriculture. And this is because fish are naturally occurring in the environment and they're not being raised for the purpose of animal production. But fisheries, that where there are workers who are helping to raise, maintain, and feed the fish, those workers are considered agricultural workers. So sometimes if you think about the tasks that they're specifically doing, that's a pretty good indicator of whether their industry is and tasks fall within the definition of agriculture. There are some other animal production that might not be commonly thought of, but are also included. And that's things like horses, donkeys, llamas, bees, crickets, and worms, fur-bearing animals, lab animals, and companion animals like dogs, cats, and birds. And then we have our support activities for animal production, and that includes things like boarding, branding, reproductive services, livestock spraying and cleaning, and things of that nature. So on this slide are a list of tasks performed by agricultural workers. They're just some examples. It's not an exhaustive list, but it is really helpful to be familiar with the industries that agriculturals work in. And it's also important to be aware of the tasks that agricultural workers are doing. When it comes to ag worker identification, agricultural workers are not going to come into your health center saying, I'm a migratory agricultural worker, or I'm a seasonal agricultural worker. That's our language, not theirs. And so agricultural workers may self-identify or describe their work by the tasks that they're performing. So it is important to be aware of the type of tasks and industries that are occurring in your area so that you can better identify and be familiar with the type of work that workers in your area may be doing. And we will share a resource during the resource section of this webinar, sharing a tool that can help you in the process of capturing those common tasks, industries, and crops and animal production in your area through a front office kind of cheat sheet. It's a great activity to do as a team to talk about what are the names of the employers in your area, what are the common industries and tasks, how do ag workers commonly self-identify themselves when they come into your health center, things like that. So there are some tasks and industries that are excluded from the definition of agriculture that may seem like they could potentially fall within agriculture. So we're going to go over a few of the common ones here on this slide. So a few of the excluded industries are meat and meat product merchant wholesalers, landscaping services, spectator sporting, and trucking, timber, and specialized freight. An industry to take note of are nursery workers. Nurseries and nursery workers are classified as agricultural workers because they're engaged in growing plants, seeding the flowers and trees and plants. Individuals who work in nurseries that produce seedlings for market, commercial, or retail, they do things like prepping the soil, planting the seeds, watering, and caring for what they're growing. So they can be classified as agricultural workers. But landscaping, for example, landscaping companies are primarily hired to maintain landscaping areas or install the plants and flowers and trees into the ground. So they're not necessarily caring for growing and doing those agricultural tasks. They're just installing those items into the ground. So it moves to a different industry when it comes to landscaping. Okay, so we've gone over definitions, the key definitions for the ag worker verification process and the included and excluded tasks and industries to consider and that meet the definition of agriculture. And so now we're going to move on to the ag worker verification process. So there are 6 steps in the ag worker verification process, and we're confident that if you follow all 6 of these steps, you will be able to accurately classify your patient as an agricultural worker, or you'll know that you can't classify them as an agricultural worker. So we're going to break down each step, and each step will have a slide that looks like this, and the navy box at the bottom has the verification question that goes with that step. So these verification questions are important to have on your registration and intake forms, to have in your policies and procedures, because these reflect the definitions and verification questions for accurately reporting your agricultural worker patients. So we'll first start with establishing occupation. So the verification question is, have you or anyone in your family worked in agriculture? Step 2 is to verify the time frame. So if you remember from the definitions, the time frame is, have you worked in agriculture any time in the last 24 months or 2 years, that 2-year time frame. So our question is, have you or anyone in your family worked in agriculture in the last 2 years? One important thing to note with the time frame is that we know, due to the nature of agricultural work and seasons, some agricultural workers will engage in other industries outside of agriculture for income during the off season and things like that. So an agricultural worker may come into your health center currently working in agriculture, or they may come into your health center currently working in construction or another industry that may also be seasonal that they work in to supplement their income. And so it's important to note that it doesn't matter how many days, months, or weeks of the year that an agricultural worker has worked in agriculture. It is if they have worked any time in the last 24 months or 2 years, you can answer yes to this question. So the amount of time, there's no requirement. It's just any time within that time frame. Okay, so step 3 and 4 will be determining whether the patient is a migratory worker or a seasonal worker. So in step 3, the verification question is, have you or anyone in your family established a temporary home in order to work in agriculture? So if you remember from our definition of migratory agricultural workers, the key part of that definition is that migratory workers have to establish a temporary home in order to be considered migratory. It's important to remember that the distance that a person travels to do agricultural work is not important. What's important is if the person has to establish a temporary home in order to do their work. So housing determines status, not the distance. So I live in Texas, and Texas is a really big state. So you could live in the Panhandle and travel down to the southern part of Texas, and you're not going to be able to return home at the end of the night if your home base is in North Texas. So you have to establish a temporary home in order to do work. So you don't have to cross borders, state lines, certain number of miles or hours of travel. It just is whether you have had to establish a temporary home. So if they do not have to establish a temporary home in order to do agriculture, we move on to step 4 to determine whether they might be a seasonal agricultural worker. So the verification question here is, have you or anyone in your family worked in agriculture on a seasonal basis without having to establish a temporary home? So what does seasonality mean? It is not very clearly defined in legislation and is often can be defined too narrowly, but seasonal basis really means that the worker's employment and income fluctuate with changes in conditions and the kinds of agriculture that they're working in. So we know agricultural workers, there are many factors that impact their work, such as weather, demand for the commodities, the workforce, natural disasters, all kinds of different things impact um, the seasons of work, the hours of work, wages earned, and things like that. So instability or seasonality is really that instability of where a worker may experience changes in the type of job, the hours that they work, their wages, things like that. And so this fluctuation and change is really what determines their seasonal status. And one thing to note here is that there's a little asterisk at the bottom of the slide. Seasonal agricultural workers may appear to be employed throughout the year for each crop season, and it might look like full-time work. But if you think about it, they're changing crops for the season. They could be changing employers because of that. They could be changing hours worked. The wages could change. So all of those things result in fluctuation and change in their work. So that's kind of how we define seasonal status. Okay. We'll get through these verification questions and then I'll come back to some of these questions in the chat. Thank you for putting those in there. Okay, so step 5 is identify all family members. So as you remember from the beginning of the presentation, all family members you want to identify all family members because they will all be classified the same as their agricultural worker family member. So the verification question here is, have you, oh, I'm so sorry, I skipped a step. Step 5 is identifying former migratory agricultural workers. That third classification type that we discussed in the classification definitions. So our question here is, have you or anyone in your family stopped migrating to work in agriculture because of age or disability? So these are former migratory workers only that are no longer migrating because of age or disability. And as I mentioned, this is a newer classification type as of the Consolidation Act, and it was expanded to include age and disabled migratory agricultural workers. And some of your patients prior to retirement or disability may have been both migratory and seasonal at some point in their career as agricultural workers. So it's important to ask if they've ever migrated to work. If they did, then you can classify them as aged and disabled. And this classification doesn't apply to all seasonal workers, just our former migratory workers. And you'll report these patients as migratory in your UDS reports. And the final step, which I said before, is identifying all family members. So all family members of verified agricultural workers are also classified as agricultural workers. So this is regardless of the family member's insurance status or anything like that. They should be classified as migratory or seasonal, the same as the primary agricultural worker family member. This applies to children, and it's important to cross-check and make sure that you're accurately capturing all family members. One thing to note here is that the UDS manual, which we shared a little bit earlier in the presentation, does have information regarding the definition of family members or dependents. Each year, sometimes they go back and forth on whether we're using the terminology family members or dependents, but it's very, very loosely defined in the UDS manual guidance. So it's important for health centers to decide the definition of family members that you're going to use and follow for consistency in your UDS reporting. So health centers sometimes have very narrow definitions of family members, like they have to be a financial dependent of the agricultural worker. And some health centers have very broad family member definitions that just include anyone who lives in the same home of the agricultural worker. We know agricultural workers have unique living situations where sometimes multiple generations or multiple families may live under the same roof. And some health centers will classify all of those the people living with agricultural workers as family members for their UDS reporting. The most important thing with identifying family members is consistency. So making sure that everyone at your health center is on the same page on what your definition of family member is, making sure it's reflected in the policy or procedure, and that you're just consistently using the same definition. Okay. Let's see here. I'm going to try to go back to some questions here. So the next section of this webinar is going through some case studies. So I think I'll answer some questions in the chat first, and then we'll move on to practicing some case studies. And going all the way back to Stephanie's question, the slides will be shared from today. So you will have all the resources shared in these slides and throughout the presentation to take with you, to review and keep for your own use. Okay, so a question. Dairy processing that occurs in a production warehouse is not included. Correct. If the production warehouse is not owned by the farm or on the property of the farm, then it would not be included as agricultural work. Are intake forms required, or will utilizing our EHR system meet the requirement for verifying and identifying the population? So yes, I use the term intake form to kind of generally mean however you capture that information for your patients. So a lot of health centers have the verification questions included in their EHR so that when you're doing intake with patients, those questions verification questions are included there. So there's no requirement specifically on how you have to do it. But that's one way, is including it in your EHR or in your patient registration forms if you use those, whatever your process is. And if you have questions on that specifically on intake forms or your EHR and how to make sure that you have your verification questions in there so that patients are being correctly identified and reported, you can reach out to us and we can provide some technical assistance to support you in that if you're interested. So this is a great question. What if a patient works in a nursery all year long? How would you determine status? So that is a great question. That scenario could go a couple of different directions. So it would be important to go through all 6 steps to kind of make sure you have all the information on their work. But nursery work does fall within the definition of agriculture, so they can be classified as an agricultural worker. It would just depend on whether you can classify them as migratory or seasonal. So you'd have to ask those questions on whether they establish a temporary home to do their work or whether there's seasonality in their work to determine their status. Okay. Yes, all links will be shared at the end of the presentation. Okay, I think our last question here. What if in a household family members have one of each? Okay, so if in a household there's one migratory worker and one seasonal worker, that's a really great question. Um, I haven't heard of that situation before or had that question, but I think what would be important is just being consistent with however you decide to classify each family member. So let's say there's maybe in a family, there's a parent that's seasonal. So they're settled in your community and they have their spouse and children in your community, but maybe there's an adult child who's migrating in agriculture. Um, I would say, classifying the family members that are consistently coming into your health center as seasonal with that seasonal family member. And then when you see the migrating family member, that's how you classify that number. I think there's a couple different ways you can do it, but there's no strict rule on how to go about that. I think it would just be important to be consistent with whatever your health center chooses. Okay, let me check the Q&A box real quick. Where would you classify an aged and disabled? Oh, I did that one. Migratory workers, for the most part, travel without their family. However, they support them financially. How do you consider the worker family of one or the number of his supported family? Example, married with children. So yeah, that's a great point. Some migratory workers travel as a family, some don't. And whatever the case is, that worker and their whole family will all be classified as migratory agricultural workers. And the definition of family, I noticed you put some specific language around support them financially. For HRSA's purposes and for UDS reporting, financial support is not part of any of these definitions. So the family member that is doing agricultural work does not have to be the primary breadwinner, for lack of a better word. They don't have to be the sole financial support for the family or the main financial support for the family. That aspect does not matter. Unless it matters to the definition your health center has set. Some health centers do have specific aspects of their definition around that. But from HRSA's guidance, that's not a requirement that they've provided for UDS reporting. Okay. Is a worker considered seasonal if they work full time during spring, summer, fall, and 10 hours a week the remainder of the year? Yes, that would definitely be considered seasonal work. So I was just reading it again in my head thinking. I think that's a great example of seasonality. So we know that there are seasons of the year where agricultural workers are working full time, if not more than full time, during those busy seasons. And then in the off seasons, their hours may reduce by a lot, or they may take up work in a different industry. And so that definitely would meet that fluctuation for seasonality. Okay, I think I've gotten to everyone's questions. If I didn't fully answer your question, please put a follow-up in the chat or the Q&A box. Any questions that we don't get to during the webinar today, we will make sure we share and follow up. So I'm going to move on to going through a case study here, and then we'll talk about some resources to support you in your ag worker identification process at your health center. So the case study we have here, I'm going to read this patient scenario, and we're going to go through the 6 steps of the ag worker identification process. And if you all can, I'm going to open up the chat. If you can use the chat and share with me how you would answer each verification question by putting in the chat yes or no. And then when we get to step 6, I'll have you all share how you think we should classify this patient for UDS reporting. Okay, so we have Manuel. He's 12 years old, lives in Texas. He was recently diagnosed with diabetes, and his grandmother brought him into your health center for his 3-month follow-up appointment. We know that Manuel's mother and father are currently working in Colorado harvesting barley for the next 2 months. So, step 1, establishing occupation. Is agriculture the principal employment? Has this patient or anyone in this patient's family worked in agriculture? Yes or no? Okay, Miguel says yes. Melissa says yes. Okay, lots of yeses. Okay, excellent. So then we'll move on to step 2. Let's determine the time frame. Has this patient or anyone in this patient's family worked in agriculture anytime in the last 2 years? Yes or no? Okay, lots of yeses. Awesome. Okay, not seeing any no's. Okay, so we'll move on to step 3. Has this patient or anyone in this patient's family established a temporary home in order to work in agriculture? Yes or no? Lots of yeses. So we'll rule out seasonal status. Has this patient or anyone in this patient's family worked in agriculture on a seasonal basis without having to establish a temporary home? Yes or no? What do we think based on the information that we have? I know it's a very brief description, but based on what we have, do we okay, getting some no's, a no question mark. Okay, so now we'll move on to step 5. Has this patient or anyone in this patient's family stopped migrating to work in agriculture because of age or disability, based on the information that we have? Okay, so no's, all no's. Great. Okay, last step. Let's identify all family members. So how many family members based on this description can we include in this classification? Oh, so fast, Amy. 3, 4, 4, 3. Okay, we're split. Split between 3 and 4. Okay, we'll come back to chat about this, but next would be to determine Manuel's status. So how would you classify this patient in your UDS report? Migratory, seasonal, or can we not classify him as an agricultural worker? Okay, a couple of mostly migratory, a couple seasonal. Okay, awesome. Great work, everyone. Manuel should be classified the same as his parents, a migratory agricultural worker. And I know that it's tough with when we think about his parents are working a harvest season, working barley in Colorado. And I think sometimes thinking of that, like they're working for the season at this location, can make you think they could be a seasonal worker. But it's important to think about, okay, Manuel lives in Texas, that's their home base, and they're going to Colorado. His parents are in Colorado currently working. So they're migrating to Colorado to do that work. And he has stayed behind in Texas and is potentially being cared for by his grandmother. So for some of you that said 3 or 4 for number of family members that you could classify as an agricultural worker, obviously that would be somewhat dependent on your health center specific definition, but technically you could classify 4 patients as an agricultural worker: Manuel, his grandmother, and both mother and father parents. So if all 4 of those family members are coming and accessing your services, all 4 of them would be classified as a migratory agricultural worker. Any questions on that scenario? Okay. If you think of any, please put them in the chat. Excellent. So there are 2 additional case studies that are in the PowerPoint that provide all 6 steps to go through and the correct answer at the end of the slide. We don't have enough time today to go through all 3 of them, but I encourage you to use those case studies as practice on your own or with your team after this webinar. So I want to move on to sharing some resources that I think will be really important in supporting your work in accurately identifying agricultural workers at your health center. So we'll share the links to all these resources in the chat now and in follow-up. But this webinar is recorded and we do archive this webinar on our website. We record and archive this webinar in Spanish every other year. So we do have last year's Spanish presented webinar on our website as well. So that's a 60-minute webinar recording. If you're looking for a shorter training to review this ag worker identification process, I would encourage you to check out our ag worker identification training tool. This is a 10-minute video. That's a great introduction to the ag worker identification process for new team members, as well as a refresher for seasoned staff. It goes through the definitions and the 6-step verification process. So it's a great refresher tool. We also have a frequently asked questions and IAC Q&A packet. This Q&A packet gathers frequently asked questions from webinars like today, from IAC workshops, trainings, conferences, things like that. And we've compiled them all in this packet and provided in-depth responses to answer those frequently asked questions. A resource that I mentioned earlier in the training is the Ag Worker Identification Front Office Reference Sheet. This is a tool designed to help health center staff to ask the right questions and accurately identify and classify your ag worker patients in the UDS. This is a customizable PDF where you can compile those common tasks, industries in your area and have it at the front desk to help support the ag worker identification process. And then the last resource on this list is identifying and reporting H2A workers in the UDS. This resource is new as of, I think, 2 years ago. We have been seeing across the country, learning from health centers, that the number of H2A workers has been increasing and that health centers could use support in knowing how to accurately identify and report them for UDS reporting. So H2A workers, if you're not familiar with the H2A visa program, It is a program that brings agricultural workers from outside of the US into the US to do agricultural work through the H-2A visa process. And so those workers are always coming from outside of the US, and they are provided employer provided housing to do work in the United States. So if you think about the 6 steps and how, in order for a worker to be a migratory agricultural worker, they have to establish a temporary home, which is exactly what H-2A workers do. So if you have H-2A workers in your community that are accessing your health center, they're always going to be classified as a migratory agricultural worker. So that resource kind of breaks down what I just described very quickly. It goes through a case study scenario. It also provides some demographic and background information on H-2A workers and the H-2A visa program, if that's something that your health center could use some support and education on. Okay, and I've mentioned IAC in the Increased Access to Care for Ag Workers program, I think a couple times related to resources, but the IAC program and its associated training opportunities were launched in collaboration with the Ag Worker Access Campaign to assist health center staff in accurate identification and reporting for ag worker patients in the UDS. So this program and its offerings are very important, and we would like you to know about them to support your ag worker ID process, as well as just increasing access to care for ag workers in your communities. So there's a couple of opportunities that the IAC program offers. The IAC program hosts a learning collaborative each year that gathers health centers from across the country to swap promising practices and strategies and talk about challenges. It brings in guest speakers, talks about hot topics, and is really a great resource for health centers to learn and have peer-to-peer exchange with other health centers across the country. We have our ag worker identification and registration quarterly huddles. So each quarter we offer a 1-hour huddle to go over the ag worker identification process and practice some case studies. So if you want a good follow-up to this session, those huddles are really helpful. We also offer migrant health action planning and UDS data trend reports to help you set goals and reach your increased access to care goals. And as we mentioned in the beginning, we would love for you to join the Ag Worker Access Campaign and show your support for increasing access to care for this important population. There's a link in the chat to sign up or use the QR code on the screen. And as a member of the campaign, we share resources, tools, and opportunities for your health center and organization to support increasing access to care for ag workers. And this is the end of our live presentation. Thank you to those of you who are watching the recording, and for those of you who are joining live, please remain on to fill out a brief evaluation.